Gallardo. My topic is polydramnios transient antenatal Bartter syndrome and the MAGA2 mutations. The definition of the polydramnios is a medical condition describing an excess of amniotic fluid in the amniotic sac. The second definition is about the Bartter syndrome. This represents a set of closely related autosomal recessive renal tubular disorders characterized by hypokalemia and hypochloremia, metabolic alkalosis, and hyperenemia with normal blood pressure. Then we have the definition. The Mayan genes are the Mayan genes. These are clustering of chromosome XP11. This gene is located in XP11-2, a hotspot for X-linked intellectual disabilities.
Bartter syndrome is a rare inherited defect in the thick ascending limb of the loop of Hien. It is characterized by low potassium levels, increased blood pH, and normal to low blood pressure. There are two types of Bartter syndrome, neonatal and classic. A closely associated disorder, Geit-Hellman syndrome, is milder than both subtypes of Bartter syndrome. Features: in 90% of cases, neonatal Bartter syndrome is seen between 24 and 30 weeks of gestation with excess amniotic fluid. After birth, the infant is seen to urinate and drink excessively. Life-threatening dehydration may result if the infant does not receive adequate fluids. About 85% of infants dispose of excess amounts of calcium in the urine and kidneys, which may lead to kidney stones. In rare occasions, the infant may progress to renal failure. Patients with classic Bartter syndrome may have symptoms in the first 2 years of life, but they are usually diagnosed at school age or later. Like infants with the neonatal subtype, patients with classic Bartter syndrome also have polyuria, polydipsia, and a tendency to dehydration, but normal or just slightly increased urinary calcium excretion without the tendency to develop kidney stones. These patients also have vomiting and growth retardation. Kidney function is also normal if the disease is treated, but occasionally patients proceed to end-stage renal failure. Bartter syndrome consists of hypokalemia, alkalosis, normal to low blood pressures, and elevated plasma renin and aldosterone. Numerous causes of this syndrome probably exist. Diagnostic pointers include high urinary potassium and chloride despite low serum values, increased plasma renin, hyperplasia of the juxtaglomerular apparatus on renal biopsy, and careful exclusion of diuretic abuse. Excess production of renal prostaglandins is often found. Magnesium wasting may also occur. Diagnosis: people suffering from Bartter syndrome present symptoms that are identical to those of patients who are on loop diuretics like furosemide. The clinical findings characteristic of Bartter.
The next theme is the application in medicine. To uncover the molecular cause of this possibility explained disease, we perform whole exome sequencing of DNA from the two members of the index family and target gene analysis of other members of the family and of 6 additional families with affected fetus. We also evaluate a serial woman with idiopathic polydramnios who were pregnant with male fetuses. We perform immunohistochemical analysis, knockdown, and overexpression experiments, and protein-protein interaction studies. Then we have the pros and the cons. Usually, the treatment for these patients don't have a known.
Babies in the uterus are surrounded by amniotic fluid. However, some women do develop increased amounts of this amniotic fluid as the pregnancy progresses. And at around 30 weeks, some women are found to have excessive amounts of amniotic fluid around the baby, and this is called polyhydramnios. Now, it might be felt by the midwife on palpation, or it might be diagnosed on scan. But certainly, depending on what the findings are, would determine the management from then on. In the majority of cases, polyhydramnios will resolve itself, and the woman goes on to a perfectly normal, healthy baby. But polyhydramnios in some cases can show an indication that there is a problem with the baby. So it might be that the woman is sent for further tests. She might need to have an amniocentesis. The mode of delivery again might come into question depending on what the findings are. With polyhydramnios, because of the amount of fluid that is circulating around, there can be a risk of the baby's cord coming down in front of the baby's head if the waters break. So again, it would be very much on an individual basis how it would be managed.
But rather help that they have a better quality of life. However, the lack of care on the part of the nursing staff can result in serious sequences. The issues apply.
Twin-twin transfusion syndrome, commonly referred to as TTTS, is a complication of monochorionic or identical twins where the fetuses share one placental mass. TTTS is a very serious complication that requires immediate surveillance and treatment from a maternal fetal medicine specialist. Your pregnancy began as a single sperm fertilizing a single egg. This egg split very early in pregnancy between the 2nd and 5th day after conception to create what is known as monozygotic twins, also known as identical twins. Identical twins are the same sex and share identical genetic characteristics. Although they are in two sacs, called amniotic cavities, the entire pregnancy is surrounded by a single outer membrane called the chorion. The medical term for identical twins, therefore, is monochorionic diamniotic. The one feature of monochorionic twins that results in complications is the fact that they share a common, single placenta. In the great majority of these cases, blood vessels connect the two blood systems of the twins with one another. Donor versus recipient twin. In about 10% of identical twins, a phenomenon known as twin-twin transfusion syndrome, TTTS, begins typically early in the 2nd trimester. This
one fraction 80-30 million individuals. This genetic variant is not very common among the Ecuadorian population.
I am Dr. Suhasini Inamdar. I am obstetrician and gynecologist from St. Philomena's Hospital at Cloud9 Old Airport Road, Bangalore, India. Amniotic Fluid Index or AFI is measurement of amniotic fluid during pregnancy in the womb. It is a measurement which is taken by sonologist and it is given usually in millimeters or centimeters. The normal range of amniotic fluid index or AFI is 8 to 18 centimeters. and it is measured by a sonologist when you go for your checkups, and this is a very good indicator of fetal well-being and a healthy pregnancy. The AFI is measured by dividing your uterus into 4 imaginary quadrants. In each quadrant, then a clear pocket of amniotic fluid is seen and measured vertically. What I mean by clear amniotic fluid pocket is there should not be any fetal parts or umbilical cord in that area. So we get whatever is the fluid as a correct measurement. Then all these 4 measurements are added on and the sum is given to you as amniotic fluid index.
Finally, we have the conclusion. We found that MAGEN2 mutation causes X-linked polydramos with prematurity and severe but transient form of antenatal bladder syndrome. MAGE2 T2 is essential for fetal renal salt reabsorption, fetal fluid homeostasis, and the maintenance of pregnancy. Funded by the University